Dr. Ross, when people come to the chiropractor, they often come for backache, but backache englobe a lot of different things. Can you explain us a little bit where does what is back pain exactly?
That is a very good question. The spine is the strongest part of the body. Why is it in pain? You shouldn't have any back pain at all. And back pain is usually the lower back pain all the way down. So what I'll do is I've got my little spine here, and I'll explain the anatomy of the spine. So the back pain usually comes from the lower lumbars. You can see there's 5 green. Those are the 5 lumbars. And that attaches to the sacrum. That used to be 5 bones, but then goes to 1 bone after we're born. And the sacrum is the orange. And then we have our little coccyx at the end, is where the actual spinal cord that comes down from the brain actually attaches. Now the sacroiliac joint, the sacrum, is orange, and the ilium is the white. And there's 2 joints. They carry all the weight as we walk back and forth and back and forth. So they shouldn't be painful. We usually then find one side is painful and the other side is not. And that's when I started measuring the balance of patients and would find out that they were physically out of balance, and it ends up kind of at the bottom of the barrel in the lower back. You can adjust the lower back, you can stretch the lower back, you can exercise the lower back. It's not the problem. So what we found out at the Body Best Doctors is we come all the way up the spine. There's 12 thoracics, those are the blue. There's 7 cervicals, those are the lavender. And then we have this funny thing up here called the occipital bone. That's the base of your skull. And it gets knocked off balance, throwing the entire body off balance. And that was just a revelation as far as what was causing the actual problem. I would ask patients, have you ever been in a motor vehicle accident, fall, or an injury? And then they tell me multiple times sometimes. And so usually from that time forward, they're not going to feel good. It's like a car gets in an accident and the frame gets bent. If you don't take it to the frame shop and get the frame fixed, the car will never drive the same. And that's what I see with patients that have been in past accidents and injuries. Nobody finds the actual cause of the problem, which is way up high in the head, in the neck, or the first vertebrae called the atlas. And they never get better. They don't sleep good. They don't feel good.
So oftentimes, the lower back pain, if you can show the spine again, the lower back pain don't come from that. The origin of it is on the top, from the occiput. Can you show us the occiput again?
All the way up here is the head sitting on top of the neck, right there. And the head is it's basically a 10-pound, we call it a 10-pound bowling ball, and it literally gets knocked off its axis and causes the stress of the whole bottom, from depression all the way down to back pain.
So how can we do it to adjust the occiput? How do we do it?
There's 2 ways to adjust any bone basically, but the occiput, we can either adjust it with the instrument, and I'll get the instrument here in my pocket. It's called the activator, and it basically, you put it on there and I'll actually adjust it, and it has a sound. And it's got a spring in here, and you can adjust it with an instrument. And sometimes I'll say, I want to check with the instrument first, and they said, okay. And then I adjust it, and it doesn't fix the problem, and I was frustrated. So then there was another method I found out, where we'd lay the patient on the table, on their stomach, turn the head to the left, and then adjust it with my forearm, and set the neck. It makes usually a little noise, no pain whatsoever. They get up, and all of a sudden, again, oh, what did you do? My back pain is gone. You didn't even touch my lower back. I said the problem was coming from your head, which I just fixed. And then there's exercises I teach them that for the head and the spine that they do every day. It just takes minutes.
Thank you. And also, people also are confused with the SI joint. Can you show us what is the SI joint pain?
That's because the sacrum and the ilium, and there's 2 iliums with the sacrum on each side, gets rotated slightly out of balance because their head is off balance, and so it puts more weight down on one leg and one hip. And when they walk, you could actually have them walk, and they can see how they're out of balance. And so it's putting all the stress on the strongest 2 joints, and one of them starts screaming at you, and it's always there. Once we find it, either from a genetic short leg or from an occiput from a past accident, then we fix them, their pain is gone.
So if people are constantly out of balance, what happened? They put so much weight on one side of the body that they wear off the hip and then can wear off their knee, and then they have to go for hip replacement or knee replacement.
That's exactly right. The ball and socket, we call this the hip joint, and that starts building up calcium because when the bones get stressed, they send out a negative electrical charge, and it says, bring me more calcium, make me stronger. Well, that's a good thing until we get too much on one side, and then you can see it on x-ray, you can see it on an MRI. The arthritis is what they call it, hip arthritis, and that hip arthritis then can go down into the knee. Then you have knee arthritis and knee replacements and hip replacements. Well, even if they get a hip replacement and a knee replacement, generally I find that when they replace the joints, they try to get the legs even. I've only seen it one time in over 100,000 patients where the doctor actually got it perfect. So then they usually then have a genetic short leg after the surgery, and that's also corrected. And then therapeutic ultrasound is done on the joint, and it actually dissolves the calcium in that area. It sends it back into the bloodstream, and the pain is gone.
So basically we can avoid hip replacement or knee replacement by getting adjusted through the Body Best Doctor method, and that way they are within 1 to 2 pounds in balance versus 20 pounds out of balance and putting 20 pounds of heavy weight on one side.
Exactly. We find out the cause of the problem. It's either the genetic short leg, and it's already caused the joint to start to degenerate, so medicine thinks they just replace it. But what caused that hip? What caused that knee to degenerate? They walk around on 2 legs. They don't have 2 hip replacements generally, and 2 knee replacements. I've seen them sometimes, but it's generally just 1. So I find the problem and correct it, and if we catch it before they get half crippled or in a wheelchair, usually we can fix them, and then when we do ultrasound, the calcium goes away, they're now balanced, and they can live a happy life.
That's wonderful. So that way we can prevent, invasive surgery of hip replacement or knee replacement by making sure that the person is aligned all the time and keep the alignment through the adjustment that you do.
Yes, and then I also remind them sometimes when they come in and are in pain, I said, I'll bet you forgot to do your bobbleheads and your twist stretches. And they say, yes, I have forgot. And so then I remind them that I do it every single day because I know that I want to stay healthy. And if I'm telling my patients to do it, I'm for sure doing it.
Can you briefly show us how you do the bobblehead and the twister?
Yes, the bobblehead is usually done sitting, and I'm standing, so I hopefully don't fall down. So anyway, it's a right, left, and you go as far as you can, and it's just more of a quick bobble than a stretch like that. We do a bobble, so it's constantly moving the joints, and it keeps those joints healthy, and it keeps the discs healthy. We can shrink up to 2.5 inches in a lifetime, and then those joints are jammed and you get into pain a lot quicker. With the bobblehead, the discs stay hydrated. Now, the second stretch that I teach is called the twist stretch. And so in a sitting position, I usually bring my hands up. I've got my spine here, but everything goes to the right, my head, neck, and shoulders. Twist to the left as far as I can go. So back and forth each way is 1, 2. And I tell them that just do 100 a day, 100 bobbleheads, and you will feel much better, sleep better, and it will change your life.
So with the bobblehead and the twister and the monthly adjustments, people are preventing, like any kind of problem that can happen down the road as far as invasive surgery that they might have on hip or knee, correct? Or neck as well.
Yes, and usually I tell them they'll have some type of an event. Maybe it's lifting some furniture, maybe it's doing other things that are normally not used to doing, and so the muscles and the joints get stressed out of balance, and then we fix them, and I teach them how to I teach them how to lift. We have special pillows for how they sleep, and I basically say, do you sleep on your backside or stomach? And if they say stomach, they're in big trouble because that's not the way to sleep. Either side is fine, or on the back. So there's lots of things we educate people about their own lifestyle that could be causing their problems.
So people can actually get out of alignment overnight by having the wrong pillow or sleeping on their stomach.
It happens regularly when they travel and they have a different pillow. And yes, they have problems. And
then
so
a neck happen or like headache.
headache. Yep.
And then they don't sleep good or in a bad mood.
They come in grumpy and they go out smiling.
That's great. Thank you so much, Dr. Ross.
You're welcome.